The community we explored for the Windshield survey was Northside. Our group consisted of Olivia Green, Maya Sanchez, Mia Wyrick, Maggie McGill, Taylor Dorrington, and Garrett Clifford. People have inhabited the area that is now known as Northside since the 1790s. Northside became its own community when it separated from Cumminsville in 1974. Northside was originally a very popular and wealthy place to live, but after the World Wars, the housing market plummeted and companies went out of business. Today, Northside is home to many businesses and active citizens. It is growing and improving each year. Northside's boundaries are marked by I-74 and Coleraine Avenue, Hamilton Avenue, and Spring Grove Cemetery. Their population is 8,996, consisting of 3,964 males and 3,825 females. Most citizens are between 22 and 44 years old. The life expectancy is 71.9 years old. The predominant language spoken is English. 18.8% of the population is under 18, whereas 12.4% is over the age of 65. The average income for Northside is $56,169 per household. Northside income ranges from $10,000 to $200,000 per year. 171 out of 1,623 family households had an income below the poverty line.
Northside are extremely well kept with paved sidewalks and great landscaping. However, many areas are marked with graffiti, have litter, and have poorly kept yards. Faye's grocery store and Kroger are both less than 8 minutes away from the town center. There are several local convenience stores and quite a few fast food joints in town. There are 4,685 total units in Northside. 52% are rented, 47.8% are owned. Most properties were built in 1979 or earlier. The closest hospital is Good Sam in Clifton. Northside does, however, have their own health clinic, home care service, acupuncture, holistic care center, dentist, pregnancy and birthing center, and independent psychologists. The health center offers programs, vaccinations, screenings, testing, and treatments. Northside has their own community e-newspaper called the Northsider, where citizens get their news from. The majority of communication is done on social media via apps like Facebook.
Northside has a good amount of green space that includes woods, parks, and even hiking trails. Citizens can go to McKee Rec Center to work out and take fitness classes, although they have a limited program for seniors. Northside has many flourishing businesses, including bars, restaurants, tattoo shops, barber shops, and clothing boutiques, many of which are locally owned. Since the community is so small, people walk or bike to and from destinations. Many houses have cars in the driveway, and those citizens who do not own cars can take the Metrobus. Northside has many political campaign signs spread throughout the community. There are numerous LGBTQ+, as well as Black Lives Matter flags. There is a community council website for those citizens who want to be active in their community's government. Northside has many primary and elementary schools, including St. Boniface, Chase Elementary, and Parker Woods Montessori. All three of these schools have yards and playgrounds for kids to utilize. Northside does not have a middle school or high school. 11.8% of Northside's population, 25 and older, do not have high school diplomas, and only 39.3% of Northside's population over the age of 25 have a bachelor's degree or higher.
After immersing ourselves in Northside, we came up with a list of challenges that the community faced. Some of these challenges include 85% of homes being built before 1960, 10.8% home vacancy status, limited access to the Northside Clinic with it only being open 8 to 5 p.m. on weekdays, limited transportation to hospitals, and limited activities for seniors. Based off this list, we created 3 nursing diagnoses, with our priority nursing diagnosis being increased risk for exposure to lead paint among the Northside population related to 85% of homes being built in 1960 or earlier, as demonstrated in an 84.47% potential lead paint exposure and an average of 8.7% of children exposed to lead paint in the community, with the Cincinnati average is 3.8%.
Our priority form of intervention is holding baby health fairs where parents with kids 12 to 14 months can receive education for community nurses about the impact of lead and paint in their homes. If the parents are aware their house was built before 1960, they can be directed to contact the Northside Health Center for more information and connecting to resources that can help people paint over the lead in their homes. This intervention can take place in one of the elementary school's auditoriums, since many parents with the younger children will be familiar with the area. Baby health fairs will include dangers of lead paint exposure, including child health risk, how to check the lead paint, and what to do if lead paint is in your home. To measure the effectiveness, there will be an online pre- and post-test at the event. The pre-test and post-test would tell the community nurses working in the Northside how many residents gained information and education on lead paint exposure. Our secondary intervention would be offer free lead exposure screenings tests at the Northside Health Center for 1 to 2 year old kids living in houses built before 1960. These tests consist of finger sticks or venous blood draws, so they need to be done in a clean and safe environment. To measure the effectiveness of the intervention, we would assess the number of people who are utilizing the free service out of the average number of families with possible lead exposures from houses in the area. We could also include that and ensure the lead exposure screenings runs for a few hours on the weekends and after normal work hours to make it accessible to those who cannot get there during normal weekdays because of business hours. We could offer surveys for patients to take to evaluate our performance on this intervention and how we could improve on it.
For our tertiary intervention, we discussed that if a community member returns with a concerning level of lead in their blood from the lead exposure screenings, we can set up chelation therapy through the Northside Health Center on Spring Grove Avenue. This will help connect families to affordable therapy. Support groups can also be held in community churches for parents of children with complications from lead poisoning. To measure the effectiveness of the chelation therapy, we can use the patient's previous blood work and compare it to new blood work after the intervention is implemented. Additionally, we can evaluate the impact of the support groups by administering surveys on improved coping and feelings of support. Our group learned a lot about the needs, strengths, and challenges of the Northside community while participating in the Windshield survey project. Immersing ourselves in the environment as part of the assessment allowed us to see where Northside excelled. Some advantages to living in Northside included community activities, social media involvement, easy access to foods, improved housing developments, various modes of transportation, diversity and inclusivity, and parks and recreational activities. While Northside had its challenges, such as the lack of acute care accessibility in hospitals, child care centers, and high schools in the area, as well as high crime rates, voter apathy, lack of shelter services, and issues with environmental pollution and lead problems, these are issues that can be solved and improved upon through primary, secondary, and tertiary community interventions. This invaluable experience helped us realize the impact community nurses, as well as volunteers and community members, can have on the health of an entire population. Community nurses play a vital role in not only maintaining the health of individual citizens, but also continually working to improve the overall health of communities.